Heart disease is an expansive term that describes a range of conditions affecting the heart, from coronary artery disease and heart rhythm issues to heart infections and more. However, when it comes to recognizing heart attacks versus heartburn, it's crucial to understand that how they present can sometimes be deceptively similar. A heart attack might cause intense chest pain, shortness of breath, and pain in one or both arms or the jaw, whereas heartburn typically causes a burning sensation or pain in the chest that might worsen when lying down or after eating. Treatment varies widely, with heart attacks requiring emergency medical attention and potential interventions such as medication, surgery, or lifestyle changes, while heartburn can often be managed with over-the-counter antacids and lifestyle modifications. Heart attacks can be more likely in individuals with risk factors such as high blood pressure, smoking, obesity, and a family history of heart disease, whereas heartburn can be triggered by certain foods, medications, or stress. Here are detailed aspects of disease, revealing the nuanced differences between heart-related emergencies and discomforts, which are pivotal for understanding and managing these conditions effectively. Affected organs: cardiovascular system versus gastrointestinal tract. A heart attack and heartburn present with symptoms that can initially appear similar, such as chest pain, but they stem from vastly different underlying conditions affecting separate organ systems. Heart attacks usually involve the cardiovascular system and are caused by the blockage of the coronary arteries, obstructing blood flow to the heart muscle, potentially leading to tissue damage or death. On the other hand, heartburn is associated with the gastrointestinal tract, where acid reflux causes a burning sensation due to stomach acid rising into the esophagus. It is essential to distinguish between the two, as a heart attack is a medical emergency requiring immediate attention, whereas heartburn can often be treated with lifestyle changes and over-the-counter medications. Recognizing subtler signs like pain radiating to the arm or jaw, shortness of breath, and sweating could indicate a heart attack, whereas a sour taste in the mouth and discomfort after eating may point towards heartburn. Quality of pain: crushing or pressing versus burning or searing. Understanding the nuanced differences in pain experienced during a heart attack versus that of heartburn is crucial for prompt and appropriate medical response. A heart attack typically manifests as a crushing or pressing pain, often described as a sensation of tightness or heavy weight in the center or left side of the chest. This discomfort may radiate to the neck, jaw, or arms and is frequently accompanied by other symptoms like shortness of breath, cold sweat, and nausea. In contrast, heartburn pain is usually a sharp, burning, or searing sensation localized behind the breastbone or sternum. It often worsens after eating or lying down and can be alleviated by antacids. Recognizing these differences could be life-saving, as mistaking the serious cardiac event for simple indigestion might delay crucial medical intervention. Onset of symptoms: sudden and intense versus gradual after eating. Heart attack symptoms typically manifest suddenly and can be severe. The pain is often described as crushing or as a pressure sensation in the chest, which may radiate to the neck, jaw, or arms. Conversely, heartburn, a symptom of acid reflux, presents as a burning discomfort often felt behind the breastbone. It generally occurs after consuming food, especially if the meal is large or contains trigger foods such as spices or acids. While heartburn discomfort tends to build gradually and can be alleviated by antacids or standing upright, heart attack pain is persistent and requires immediate medical attention. Distinguishing between these conditions is crucial, as a heart attack is a life-threatening medical emergency, while heartburn, though uncomfortable, is not usually indicative of a critical situation. Duration of discomfort: prolonged persistent pain versus episodic or transient. Heart attacks typically manifest with a persistent, crushing pain in the chest that can last for several minutes or longer. This discomfort may also radiate to other areas such as the arms, back, neck, jaw, or stomach. On the other hand, heartburn, a symptom of acid reflux, generally causes a burning sensation in the chest that is often episodic, aligning with food intake or lying down. Unlike a heart attack, heartburn discomfort is usually transient and can be relieved by antacids or by standing up. Misinterpreting these symptoms can be fatal. Whereas heartburn is rarely life-threatening, a heart attack requires immediate medical intervention. Associated symptoms: nausea and shortness of breath versus sour taste and belching. When distinguishing between heart attack symptoms and heartburn, it is vital to observe the additional signs that accompany the primary discomfort. In the case of a heart attack, individuals often experience nausea and shortness of breath, symptoms that signal the heart's struggle to sustain vital body functions. Conversely, heartburn characteristically brings a sour taste in the mouth and excessive belching, reflecting gastrointestinal distress rather than cardiovascular issues. These subtleties are crucial in a differential diagnosis, as they guide medical practitioners and patients alike towards the appropriate emergency response and treatment, ensuring that life-threatening conditions like heart attacks are addressed with the urgency they demand.